well. That is also
everyone. Now we want to welcome Mr. Lorenzo and Mr. Marco. They will talk about the epidemic analysis of COVID-19 in Italy by dynamical modeling. Welcome, Marco. Welcome, Lorenzo. Uh, the stage is yours.
Okay, so I'm going to share my screen. Okay, can you all see?
Yes.
Okay.
Okay.
Lorenzo will begin.
Thanks. Thank you for coming today. I am Lorenzo Mangoni, and with me there is Marco Pistilli. We are undergraduate students at the Sant'Anna School of Advanced Studies in Pisa. Before we start, we would like to thank Dr. Jose Correa for inviting us to talk to you about our research on the evolution of COVID-19 in Italy, as published in a paper at the beginning of last month. Today's talk is going to be organized as follows. First, I'm going to present to you how coronavirus spread out in our country and which preventive measures have been undertaken by the government to manage the epidemiological emergency. Moreover, I will describe our approach to analyze the evolution of COVID-19, aiming to capture key epidemic features for predicting future dynamics of the outbreak. Marco will then share with you the characteristics of our generalized SCION model and the parameter estimation. In the following section, I will discuss our findings, highlighting results and forecast. Well, as you know, the first Italian cases emerged on the 21st of February 2020. In the early stage, they were clustered around Codogno, a little town in Lombardia, which is the most populous and productive Italian region. Throughout the period from the 23rd of February to the 21st of March, the government has implemented a series of increasingly stringent measures. First, the north of the country, which was mostly hit by the virus, was declared a red zone, with strong limitation on movement and productive activities. These measures were driven by the high number of deaths caused by the virus and the risk of collapse of the national health system caused by the high propagation speed of the virus and by the risk of not having enough ICUs to handle the situation. The turning point was on the 9th of March, when the whole country was put on a lockdown because of cases starting to emerge throughout the national territory and in regions who were not previously affected. For the first time, the lockdown has been somewhat lifted starting from today, the beginning of the so-called second phase, announced some days ago by the Italian Prime Minister. From today on, citizens are afforded a slightly higher level of personal freedom. Now, I'd like to bring your attention to this slide, where we show the data published daily by the Italian Department of Civil Protection. In figure 1 and 2, we plotted respectively the cumulative cases and daily new cases. In the first figure, we observe an initial steep growth of the outbreak, whereas the drop in daily cases is lower. It is evident that efforts to curb the spread of COVID-19 are effective, but a long time is needed for the effects to show. The inflection point was approximately around the 21st of March. It is important to underline two facts. First, the inflection point for Wuhan was also estimated to be 30 days after the first confirmed cases. Second, we found this inflection point in the first version of our paper, uploaded on ResearchGate on the 3rd of April. So today, ex post, we can say our findings were correct. In figure 3, we plot the evolution of the mortality rates and cure rates. As it is evident, both show an increasing trend through time, with the mortality rates growth slowing down over time. Clearly, this can be due to a variety of factors, but probably the increase in death rate is due to an overburden of the health system, especially in the most affected areas of the country, and in the time span when the outbreak was growing. Whereas the increase in the cure rate is most likely due to innovative treatments and drugs that are currently being tested in Italy. Then daily tests are plotted in figure 4 to show how the Italian testing strategy has changed over time. Well, the ratio between daily new cases and daily tests is increasing, especially since the beginning of last month. Now moving on to the next point, I'd like to explain our approach to epidemic analysis. We apply a mathematical dynamic model aiming to estimate epidemic parameters and dynamics in order to offer a forecasting tool for the evolution of the outbreak. Among mathematical model based on differential equations, the classical SCION model and its extension are the most widely adopted ones. We estimate the key epidemic parameters using data showed earlier, both at national and regional level. As I mentioned in introduction, we uploaded on ResearchGate the first version of our paper 1 month ago, showing the parameter estimation and the forecast. As you may remember, in this month, the testing strategy has changed. So we account for this variation made by the public authority. Now, I'd like to give the floor to Marco to explain the details of the model and the adjustments we made to account for the change in testing strategy.
Okay, thank you, Lorenzo. So as Lorenzo has mentioned, in the paper we published on the 3rd of April, we did not take into account the number of tests performed, but since then, as the plots show, the testing strategy has greatly changed. Our model is a generalized SCION model based on that made by Peng and others in China. We estimated on the national and regional level for Italy. We split up the population into compartments. That means every individual is in one and at most one compartment. And the transition between the compartments are zero sum. So that means that if one compartment is increasing in size, another one is decreasing in size. We have susceptible individuals. Those are the ones that haven't taken the illness and might take it at some point. P, those are the protected individuals, those who by means of social distancing or the use of face masks haven't contracted the illness and are somewhat protected by it. E are the exposed individuals, those who have come into contact with the virus, but are not showing the symptoms, nor are they infective. I are the infective individuals. Q are those who have tested positive for the virus, have been put effectively into quarantine, so they're not contagious anymore. And then we have the cured individuals and the deceased individuals. Of course, the sum of the number of people within each compartment is constant over time, and it adds up to the total population within the country, in our case, Italy. We also take into account T, big T, indexed over time, which is the number of tests performed, and T small. Okay, so these are the dynamics of the model. It's a pretty much standard SIR plus model. That means it's a generalization of the SIR models. We have highlighted in red what we changed to account for the testing strategy. This specific organization of the model allows the number of newly discovered cases to be both increasing with respect to the infective stock of people and to the number of tests taken in the day. But this specific structuring allows us to have a positive and it might also be a big number of newly discovered cases, even when the tests are few and not many. Of course, the coefficients have a meaning. Alpha is the protection rate. It's the share of people that transition from susceptible to protected. Beta is the infection rate. Gamma over 1, we set it a priori. It's the average latent time. We base our research on what Peng and the others did for the Chinese case. Epsilon is the average quarantine time when no tests are done, while epsilon is the testing impact. We let the cure rate and mortality rate be time dependent because it's a lot more insightful to see their evolution over time, as Lorenzo showed in one of the graphs before. This is the estimation of the model that we find. Some of the values are particularly interesting. The infection rate is 1. That's the maximum allowable number for mathematical reasons. That means that the epidemic is very fastly spreading. Alpha, the protection rate is quite high. That means that the measures to curb the spread of the epidemic have been effective. And also, I'd like to point out that the numbers that we find for the initial exposed and infected cases are quite high. So that means that the epidemic might have been circulating for a while before it was discovered by public authorities. Our model fits the data quite well. Everything I'm saying now is about the national level. The model fits the data really well. The relative error on the total cases is 0.9%, which is very good. And on the daily new cases, it's 12.2%. Based on our estimates, we can say that the basic reproduction number of the illness at the beginning was 3.58, which is quite high. The inflection date has been on the 21st of March. We already found this number in our first version of the model. And for the rest of our results, I give the floor to Lorenzo, who will show us some of the graphs.
Okay, thank you, Marco. And now let's take a look at our forecast. In figure 5 and 6, we plot our predictions for the daily cases and for the total cumulative number of cases. As you can see here, our model fits the real data very well. And according to our estimation, based on testing 60,000 people a day, the figure for final total infected cases would be around 240,000. And our previous underestimation was caused by the relatively small number of tests performed until the end of March. We also find the last infection to happen around the 7th of May. So reasonably, the outbreak will be mostly over around mid to late May 2020. The overall estimated duration of the epidemic is slightly longer than in China, probably because of less stringent public health policy in Italy. Now, breaking down the numbers on a regional level, the results found at the beginning of April were very interesting, and ex post, we can confirm they are validated by the data. In particular, we found widely varying predicted end dates across the regions, with a lag in the dynamics of outbreak caused by a delay in start date. Also, observing the initial values of exposed and infected, we find values significantly higher than 1 for northern regions, especially in Lombardia. This means the outbreak started in this cluster and then spread out to the rest of Italian territory. The estimated number of total infected cases shows the effectiveness of anti-epidemic measures. Indeed, as predicted, the number of total infected cases in Lombardia hasn't been reached by other regions. Well, now Marco will tell us about some issues that this kind of modeling presents.
All right, so as Lorenzo has shown, this kind of modeling is really interesting. It fits the data really well, and the forecast seems very reasonable. However, this class of models is lacking in some sense. First of all, because they are inherently deterministic, while reality is not. Mainly, the effect of this is that the coefficients are somewhat not precise. We can't estimate them perfectly. Also, what I think is the most important problem with this kind of modeling is that network effects are not taken into account. For example, it means that somebody who lives in the southernmost point of Sicily has exactly the same chance as meeting somebody who lives in the northernmost point of Lombardy as somebody who lives very close by. And we know that network effects are really important. We know this from our regional analysis. Some regions are experiencing very high number of cases, while others are luckily spared by the epidemics, somewhat spared at least. Another issue with this kind of modeling is that the transitions are sequential. So all those infected will be tested eventually. That's the assumption that this model makes. However, this results in not really realistic predictions because we find the last infection to happen on the 7th of May, as Lorenzo has mentioned, but the last case to be found by authorities is much later than that. And that's not entirely reasonable because effectively everybody who gets contagious by the illness will at some point be healed without having been tested for it. Then we could somehow complicate the model to take into account these issues, but this would risk overfitting the model and greatly diminishing the predictive power of the model. Also, we can make predictions based on past policy. Of course, as Lorenzo has mentioned, we make assumptions on the number of tests done daily, but we cannot make predictions based on future policy. For example, we can't predict what today's softening of the lockdown measures will do on an epidemiological level. All in all, the model is really interesting because it allows us to fit the data really well, which in itself is quite interesting. And also the estimates for the basic reproduction number and final end date and number of cases is very reasonable, very likely. Okay, so thank you for listening. This is the reference to the paper we mentioned, and these are our contacts.
Thank you very much for your time, Lorenzo and Marco. Thank you for accepting our invitation. Thank you for sharing your work. We're happy that you made it here, and I hope that everyone enjoyed your talk. If anyone has some questions for Lorenzo or for Marco about their work, please be welcomed. We have a question from Fulgencia asking, Dear Marco et al., according to the description of the model, the state R is not reflected in the equations. What assumption did you use to have R state not considered? Thank you.
This is just a matter of notation. The state R is actually the Q state in our model. We called it Q because it was, quarantined the initial Q, so it made more sense to us.
Okay, thank you very much. Let's say that we have another question here from Sulaiman Sani. So how do we run an intervention budget strategy given the acceptability of the SIR model and its foreseen flaws without risking free lunch tendencies and its effects on the Italian economy and the global economy? It's a very complicated question, but yes.
Okay. Basically, I think this is slightly outside of the epidemiological level, and it accounts for economic factors as well. So as many of the speakers before us mentioned, it's really important to also take into account the economic impact that lockdown measures have on the country. The timing for easing the lockdown in Italy seems a bit early for us. It might have been better to just wait for some time before lifting the lockdown, considering that these past few days have showed, yes, a positive trend for the cases. They have quite diminished. We have plus 0.8% new daily cases, which is good, but it's not perfect yet. And so, especially for some regions, waiting a few more days might have been better actually for the spread of the virus. Of course, it's not really up to us to determine the weights of the economy and the weights of public health, but in our opinion, it might have been better to just wait a few more days.
Okay, very good.